How does an institution of any kind withstand the test of time after 100 years? What kind of roots does it take to produce the finest medical students and faculty members that have shaped the life and blood of health sciences, not just in South Africa, but all around the globe? Through this invitation to find the answers to the aforementioned questions, we need to look no further than the proud history of the last century of the Wits University Health Sciences faculty, a world-class learning facility for past, present, and future health sciences professionals. There is no doubt that the institution has all the requirements needed to grow from strength to strength. But what really sets the faculty aside from other health sciences institutions is the fact that graduates and faculty members alike distinguish themselves beyond the practice of healthcare. Wits Faculty of Health Sciences members and students have excelled both locally and internationally in government task teams and panels. They have served on deanships, professorial posts, and teaching posts in worldwide universities. They have manned clinical, parliamentary, and military departments. They have contributed towards editorial medical journals and textbooks. They have diligently participated in disease and research centers, dutifully chaired on boards, key governmental positions, and other task teams. They have proudly garnered accolades, medals, scholarships, fellowships, and prizes. The faculty has always been highly active in solving healthcare challenges facing South Africa and the world at large. There are so many major milestones that have paved the way for the present-day prestige of the Wits Health Sciences faculty. What does one mention? Where does one begin? Perhaps we start as far back as 1925, when the discovery of the Taung skull, Africa's first early hominid, is announced by the longest-serving dean, Professor Raymond Dart. That pivotal discovery set the stage for the recent unearthing of Homo naledi that made international headlines in September 2015. One cannot mention hominid discoveries without mentioning Dr. Philip Tobias. He is worldly renowned for working at Sterkfontein amongst other hominid digging sites. Dr. Tobias had more than 1,200 publications amongst a myriad of other outstanding accomplishments. In 1926, Esther Franks graduates as the first female ophthalmologist in South Africa. As we move into the 1930s, we find more notable mentions. Dr. James Henderson Sutherland Gear develops a powerful vaccine for the poliomyelitis disease. In the late 1930s, the red blood transfusion service is developed by a Wits graduate. The 1940s, 1950s, and 1960s were abuzz with history-making entries from Wits graduates and faculty members. For instance, the pioneering of community-orientated primary care in KwaZulu-Natal, a proudly South African giant in worldwide cardiology, makes a stunning breakthrough for his discovery of the most common valve disorder known to medical practitioners at that time. A Wits graduate and radiologist also founds Harry's Angels, the world's largest international flying medical specialist service. The following decades of the 70s, 80s, and 90s showed no signs of decrease in record-breaking wins for Wits graduates. Dr. Teresa Numa is the first African woman to qualify in dentistry. Fast forward to 1980. Bernard Tabatsnik implants the first implantable cardiac defibrillator, ICD. This is unanimously agreed to be one of the top 10 advances in cardiology of the 20th century. A little later, how can one forget the world-famous case of Wits Professor R. Lipschitz after he monumentally managed to separate the Matibular twins in Baragwanath during the year of 1988. When we hit the 1990s, we are graced with the founding of the Perinatal HIV Research Center in Baragwanath. Pioneering work is done for children suffering from HIV. From the dawn of the year 2000 until present day 2019, we turn our focus to amazing graduates who are celebrated in media. These champions of health sciences include Dr. Ngoba Tsabeze, who is researching the leading causes of heart attacks among Black Africans. Salome Maswime, an obstetrician and gynecologist, is named by the Mail and Guardian as one of the top 200 South Africans for the strides she makes at Baragwanath. Although Wits Faculty of Health Sciences has overcome great challenges in its institutional, resourceful and professional establishment, the institution was not immune to the political turmoil plaguing old apartheid South Africa. However, this did not stop notable past graduates and faculty members alike from fighting the oppressive apartheid regime as best they could in their capacity as healthcare practitioners. Dr. Donald Muikangwa and Dr. James Njongwe were officially the first Black Africans to graduate from Wits as early as 1946. Although they faced challenges such as the refusal of their services by intolerant white patients, they doggedly pursued their right to practice medicine and provided healthcare to oppressed Black South African citizens. Later, they were joined by the likes of Dr. Arthur Letele, Dr. William Frederick Nkomo, Dr. Lionel Mxolisi Majombozi, Dr. Wilson Zamindlela Ngcono, and Dr. Nthato Motlana, all Wits graduates, and all distinguished freedom fighters who served major leadership roles in the founding of the ANC Youth League. Some of these proudly Black African doctors took part in key historical moments, such as helping to draw up the Freedom Charter. The past accomplishments of the Wits Faculty of Health Sciences have undoubtedly been achieved by the enduring spirits of people who have joined the institution over the last 100 years. Every achievement needs a home. Looking at the magnificent structure of the building that is housed on Hospital Hill today, it is hard to imagine that before the year 1919, patients and doctors were housed in nothing more than a little mud hut with a thatched roof. Back then, the building could only house 14 patients, and at the worst of times, patients were forced to overflow into the surrounding tents. When we reach 1920, the most recent strides in architectural development made at the time are just sufficient enough to enable the erection of the first version of a medical school based on Hospital Street. This was a momentous historical milestone. A few years later, the South African Institute of Medical Research is built next to the hospital. It gave it a tremendous advantage. Eventually, as far as 1947, the famous Baragwanath Hospital becomes the 9th branch of the hospital. And finally, in 1978, the final 3 blocks are added to what was recognized as Johannesburg Hospital, now known as Charlotte Maxeke Academic Hospital today. In the fast-paced, ever-changing world of health sciences, there is no telling what the future holds. However, with a clearer vision of the past, what can be certain is that Wits will continue to produce more leading health science professionals who will have the capability and the brilliance not only to impact medical advancement in South Africa, but for the whole world. Here's to the next 100 years. Here's to 2019 and beyond.